Good evening, everyone. I am Varsha Srivastav, your host for today's live from All About Skin Allergy team. I hope you are keeping safe. Today, we are going to discuss about how to keep our skin healthy with focus on urticaria or hives, which we or our near and dear ones would have encountered at least once in our lifetime. Urticaria, if we'll discuss, is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain foods, allergy in certain medications, and so on. Urticaria is classified as acute and chronic, but the most important part is not to ignore it. And doing self medication can worsen its symptoms. So, in today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, and many important things related to the treatment of urticaria. So, ladies and gentlemen, today we have with us renowned dermatologist of India, Dr. Yashwant Lal, sir, live from Lal Nursing Home, Ranchi, with us. And sir will educate us more about urticaria and its management. It gives me an immense pleasure to introduce Dr. Yashwant Lal, sir, to you all. Dr. Yashwant Lal, sir, is a well-known doctor based in Ranchi who specializes in plastic, cosmetic, and reconstructive surgery. Sir has an experience of more than 34 years in different medical colleges of Jharkhand and Bihar. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you. Thank you very much.
So, sir, there are many things that our live viewers would like to know about urticaria and its management. So, let's first start with the meaning of urticaria. What is urticaria?
Urticaria is the vascular reaction of skin. It is a rash of round red welts, also called hives, on the skin that itch intensely, sometimes with a dangerous swelling caused by an allergic reaction that may be due to foods, chemicals, drugs, physical like sun, cold, heat, vibration, galvanic current, anything can do all these things. That is called urticaria in common layman's term.
Okay. And sir, what can be the different causes behind it? Why does it happen?
As I told you, food is the main cause. Many foods can cause this type of reaction, sort of allergic reaction you may call, and many additives of the food also. So foods like chocolate and sea fishes, even some kids are sensitive to milk, soya milk, banana, and crustaceans like that. Others chemicals, so many chemicals that can cause urticaria, drugs like sulfa, NSAID, etc. And physical, as I told you, so that heat, solar urticaria, cold urticaria, pressure urticaria, vibration urticaria, galvanic urticaria, aquagenic urticaria. There are so many of them.
So there are different types of urticaria that can happen, or the one like person can have to go through any one of these.
Yeah, even infection, bacterial infection like sore throat, viral infection, hepatitis A, C, these all common cold virus, cytomegalovirus can cause urticaria in certain cases. Yeah.
So, sir, what are these different types of urticaria and what can be the different reason behind it? Why does that happen?
Types of urticaria I have already mentioned. These may be depending upon the causative reason. That may be due to food, due to these chemicals, due to antibiotics, certain, due to physical urticaria, and androgenic urticaria that may be due to excessive of catecholamines, changes of temperature, cold urticaria, heat urticaria, even vibration can cause urticaria. Even we use electrophoresis currents that can cause urticaria. So these are the types of urticaria. Even there is a congenital sort of urticaria which a kid, newborn child develops. So all these are types of urticaria.
Okay. And sir, how does it look like? How can one identify that he or she is has got urticaria?
Urticaria is small vascular reactions of the skin where we get hives or welts, some people call it. It may be skin colored or maybe slightly reddish sort of thing surrounded by reddish halo, and it may last for a while, may persist for some hours or like that. When it is prolonged with edema, some sort of edema that is called angioedema, which may last for 2-3 days or even longer than that.
Hmm. Okay. So, sir, does urticaria or hives go on its own, or one has to take the proper medication to get rid of it?
Pardon?
Sir, does urticaria or hives go on its own, or one has to go for the proper medical treatment only?
Urticaria is of two types, acute and chronic. When you are getting urticaria, you have started getting it, then it is acute. 1 day, 2 day, 3 day, 4 day, like that, 1 week. If it is occurring for more than 6 weeks on total, then it is called chronic. So if it is of a mild variety, usually it goes on its own. If you feel some sort of difficulty, itching, of course, there may be itching more, less intense. In that case, you have to consult a doctor, skin specialist, and get the medicines. Don't try to self-medicate yourself. That may be dangerous. And depending upon the vigorosity of the reaction of the urticarial, this may be hypotension, that may be anaphylactic type of shock type of thing. So in that case, that is an emergency. So in that case, you must go immediately to the hospital and get admitted yourself or like that. And of course, if it is not going by itself, then you have to consult a doctor.
Okay. Okay. So the best thing like we got to know over here is that one should not try to find the solution on its own. So they have to go and consult a dermatologist and try to find out the solution for it. Okay. So sir, let's discuss about the treatment part. So are there any tests which are conducted to know the type of urticaria one has gone through, or there are no tests needed at all?
There are certain types of tests which can be conducted. In acute cases, generally no change in seen and found. But in some cases, you may go for blood test, differential count especially. And there are certain types of, if it comes out to be clinically proven, discussed after discussing with the doctor that some sort of food or anything chemical or drug or like something is causing, then you may go for sensitivity test. But usually what we find that it's not of much use. So you first try to wean out the exact cause, which is not known in most of the cases. Let us accept that most of the cases it is very difficult, especially in cases of chronic spontaneous urticaria or idiopathic urticaria. As the name suggests, it is idiopathic. Most of the cases we are not able. You may discuss, you may argue, you may all do this and that with the patient for 2 minutes, 3 minutes, 5 minutes, and you will not come to any conclusion. So in those cases, you have to start the treatment. And usually, as you have asked about the treatment, H1, H2 antihistamines, first previous times we used to give H1 receptors antagonist. But now H2 receptor, which is less causing hypnosis and sleep and like that. So we are preferring H2 receptors blockers now. In many cases, you may go for the combination also. If it is moderate, then you may have to use steroids or like that. And orally, depending upon, again, upon the severity of the condition, orally and injectable, parenteral, like that. You may have to use other aspects also. Yeah, topical, generally, these are of not great use. But tepid sponging and keeping the skin supple and moist, hydrated, and like this, these all help. Calamine application, these all go to some extent to help the patient.
Okay. Okay, sir. So, sir, how long does it take to get rid from urticaria? One is taking a proper medical treatment.
Uh, as I have told you, you may get once, twice, thrice, like that. It cannot be predicted with certainty that you will not get this after 1 month, 2 months, like that. You have to continue the treatment as long as the disease is coming up. And when it goes into remission, you may stop the treatment and ask the patient to restrain from certain things. Look for the factors, for the trigger factors, which if he can find, or with your help or without, on his own, some sort of food, some sort of clothing, application, oil, soap, fragrance, deo, blankets, anything, going to somewhere and you're getting pollen grains or like that, and cement, dust, house dust, mites, etc. So he will have to point it out for himself. He is sensitive to what thing, which thing, how long he can prevent coming in contact with that thing. That is the best medicine, more important than drugs. And that will go to get help.
That is very important to know which are the triggering factors, and then you need to take proper care of it. Okay. So, sir, is this urticaria really possible because of some triggering factors, or it can also be possible because of the genetic factors as well?
As I have told you earlier, there are some sort of genetic factors also, but many cases, one is unable to find any cause. The patient as well as doctor. Suppose one is doing well, he has just moved from his home to the office and he has started getting this. Some is traveling somewhere, he has started getting this. So as I have told you, somebody is doing work on some machine tools, he has started getting it. So it can also be caused by solar radiation. It can also be caused by cold, come in contact with ice cubes or like that, you get some very hot, humid atmosphere that may cause perspiration, exercise induced cholinergic urticaria. So you may not be able to find out, but if you get it, you must take it. Exercise induced, there are also medications for the chromoglycate or like that, so that you don't get it. And if you get it, then you go for the treatment.
Okay. And sir, is this a problem, a communicable disease? Other person can also get it from the person who is going through it, or it is not communicable at all?
Thankfully not. Thankfully not.
So this is the biggest.
It may be genetic, but not contagious.
Okay. So the good thing is it is not contagious at all. So the person need not to worry who is sitting or standing next to the person who is suffering.
He can mix up. He can mix up with that person well. Maybe his brother, sister, child, maybe parents, like that. No problem.
So the awareness is really much needed to all the people who are suffering or not suffering from urticaria. It is very important to know that it is not contagious. There's no need to worry about it. Okay. And sir, the person who has got urticaria and is taking the proper treatment, so is it really possible to get rid from urticaria through medication, or in sometimes we have to follow some surgical methods or some other methods as well?
No, surgical methods are not going to help here. You have, first of all, certain preventive measures Keep away from the triggering factors. Try to keep yourself at a safe distance. Some construction is going on, don't go there. Don't come in contact with cement, with dust, with like that. Don't undergo extreme changes of temperature, heat and cold. Don't come in direct contact with ice cubes, vibratory tools, and drugs as far as you can know. NSAID, you are taking NSAID once or twice, you notice that I have got this type of thing. Better avoid it. Not better, you must. Suppose you have taken penicillin, you have taken sulfur drugs or like that, you have started getting this thing overall skin and like that. You must stop. Otherwise, in the next step or next after that, you may get into trouble. You get worse and then worst. You may go for hypotension and anaphylactic shock also. Swelling, angioedema, you can get over your lips, eyes, lids, I mean, and tongue, larynx. And if it goes to the tongue and larynx, it may obstruct your respiratory passage, and that you will get into trouble.
So we cannot take the chance of ignoring urticaria or hives at all. And sir, is urticaria really painful?
Not always, sometimes, not always.
Okay.
Angioedema is most of the time not painful.
So sometimes it might be like painful for certain.
To some extent, to some extent.
Okay. Okay. And sir, apart from the medication or the avoiding the triggering factors, can we make like some dietary changes also, or include some food items in our diet so we can treat urticaria?
Dietary changes, we take a detailed history from the patient, what he consumed today morning, last evening, last day, day before that. What is his regular habit of staple food, like that. And we try to pick up any clue from that which can cause. So in certain cases, like in kids, babies, they keep crying and crying and crying with loose motion and all this and that. And we are unable to understand, but fault lies there in the milk. His gut is sensitive to the milk. We change it. Like there is a disease where gluten protein of the bread wheat is involved. So we remove the thing. If it is due to blanket or anything, if it is due to mustard oil, if it is due to some sort of sulfur drug, penicillin, anything like that, chemicals, paint, varnish, cement, dust, mite, anything, flower, pollen, you must avoid that. If you notice that while you are going to the garden or your kitchen garden for taking care of the valuable and lovable plants you have planted over there, and you are getting this thing, then you must understand that, okay, there is something there which is causing this to me, and you must avoid that.
Definitely.
Look for some other way out.
That is very much needed.
Yeah.
Okay. So, sir, can urticaria be caused because of stress as well, or there is no relation of stress with urticaria?
Of course, it can be caused by stress. As I told you, many times we are unable to understand the cause, exact cause. But urticaria can be caused by stress, has been documented in our standard textbooks, and in our day-to-day practice also we have noticed it, that it can be caused by, or if already it exists, it can be exacerbated by stress. You go for the lifestyle changes, you go for the timings, you go for the change of certain habits, workload, this and that, and it will ameliorate.
Okay.
Of course, it is get a great importance.
Okay, so a very important point we got to know over here, that urticaria is possible because of stress as well. So
Yeah.
try to have a proper stress-free life so you're not suffering from urticaria.
Mhm.
Okay. So, sir, as we know that urticaria is the round rash that like really causes itchiness. So during night, do the patient feel very like they feel the pain during night only? So what can be done to get rid of such pain during night?
You are asking about pain, or you are asking about urticaria?
Urticaria. Urticaria, like
Urticaria,
how to get relief from
urticaria
such a pain.
rashes. What happens during daytime, right from the moment we are up over our bed, we start coming in contact with this, that toothpaste, oil, application, deo, everything what you can, one can be in the modern society, different sort of dresses, fibers, shoes, socks, spray, deo, going to different sort of environment. So all this come to accumulate. Your breakfast, what you have consumed in your daily choir, that is during your lunch, in your evening tea, high tea in the night. So all these accumulate and cumulate to affect, maybe to affect your body, your skin. It may be your pajama, night suit. Maybe you have turned on the AC and you are looking for a blanket or like that. That also is going to cause. Many a times it has been seen that fungus or bacteria, any sort of infective organisms which has not been filtered by the AC, that is causing urticaria. A person was whenever summer season came, he used to turn on the AC. And after 3 4 days, he used to come. I'm getting this, I'm getting that. So you have to look very carefully. And these all things can um, contribute to the articular rashes, which is more marked during night after evening.
Okay, definitely. So, sir, we'll take a few questions that we have got from our live viewers. And the first one is from Asha Bansal. And she's asking, sir, what causes recurrent urticaria?
Anything which has sensitized your skin, your system, whenever you come into contact with that thing, suppose any drug, whenever you go and take that drug, that medication, NSAID, antibiotic, whenever you go for common cold, viral, hepatitic, anything, any dress, any fiber, any socks, any sort of thing, spray, deo, that may cause recurrent urticaria.
So, these are the different causes that can give rise to recurrent urticaria.
Any food like that.
Okay, any food items.
Yeah.
Okay, so next question is from Madhu Soni, and she's asking, are there other treatments that could help rather than taking medicine to overcome my allergies?
As per the treatment I have told, I have figured it out that to avoid the triggering factors. Triggering factors, dust and cement and all these pollen and that. So what does it mean? You have to go for the clean environment, clean air, green environment. It doesn't mean that you go to Darjeeling, you go to Masuri. Everybody can't do it. But he can create his own environment, better environment at his home, at his office place, in his car, everywhere. You have to look, you have to keep your roads, your gully, your muhalla cleaner. Start a campaign, cleaning it every Sunday like that. Don't use the fibers like blankets and these bed sheets kept for the last 15 days, 1 month, and then you take it out from the wardrobe and just use it, pull it over your body. Don't do like that. Start afresh and start some diets as what we at RIMS and I personally ask the patient to avoid certain things about the diet. You have already asked the certain Wart diet, Wart, that is beans, nuts, brinjals, and what pulses, I don't know. I know Urid pulse, Khesari, like this. So what I have seen that many times I find that what have you ate last day, what have you taken. So try to avoid these things. And these are very important. All of the time I ask the patient that prevention is more important for you people than drugs. So go for the prevention. Be clean, keep clean, and remain clean.
That is important. Rightly said, prevention is really very important. You need to be very, very careful in the beginning itself, and then you can get rid of urticaria. You don't have to suffer from it. Okay, so next one is from Parul Shinde, and she's asking, what are the causes of acute generalized urticaria?
You have used the term acute generalized. If urticaria is of moderate severity, it will be generalized. It may not be affecting the mucosa, the loose tissues like eyelids and lips and like that, but it may be generalized, dispersed all over the body. Hives and belts are there, and you must go for the treatment. Don't try to overlook this. You must go for the immediately for the treatment. Just consult a doctor and then start treating. You must go through your routine. If I have come in contact with certain things which I am sensitive to or may be sensitive, and just try to avoid it.
Okay. And sir, another question is from Sohil Singh. He's asking, sir, मेरे गले में कुछ white spot हैं, क्या ये अर्टिकेरिया हैं जो मुझे बर्थ में हुए थे और ये कैसे हटेंगे?
गले में कहाँ पर है? अंदर है, बाहर है, गले के अंदर है, फेरिंग्स में है, या नेक पर है, स्किन पर है? कहाँ पर है? अगर स्किन पर है तो विटिलिगो जन्म से बोल रहा है तो कंजेनाइटल है, निवस एनीमिकस हो सकता है। अगर बाद में हुआ है तो इलाज करेंगे, और अर्टिकेरिया नहीं है और इसका इलाज है। Many people, 90% of the cases get cured.
Okay. So, well, it becomes
really... Thing is, don't panic. Get it treated.
Yes, definitely. So, well, there's no need to panic. It's very important to know how you've got white spot and where you have got it. Then you can get the proper treatment. So you can have one-to-one interaction with the doctor, and you will get to know it better. Okay. So, sir, taking the next question, it's from Palak Dubey. She's asking, what information about urticaria should patients receive to treat themselves better when they are in their home?
I think this question has been answered earlier.
Yes.
Prevention is the best treatment. They must be aware about their own body and about their sensitivity, different sensitivities. Some things, whenever they come in contact with the body, with the skin, they cause inflammation, they cause reaction. That is primary irritant dermatitis. One thing, they come into contact for 2 times, 3 times, innocuous, nothing, 4 times. Then next time they will cause. That is called allergic contact dermatitis. So in urticaria also, it is a sort of allergy, you understand. So whenever you start responding the thing in this way of urticaria, urticaria is the presentation of allergy, of your body's presentation. Allergy is a widespread, and urticaria is one of the way of presentation. So whenever you start, your body starts presenting like this, you must get conscious and ready for the treatment. start it.
Okay. And sir, what could be the do's and don'ts for the patients who are suffering from urticaria and taking the treatment?
Mm, let us first talk about don't.
Okay.
Don't, as we have discussed, if you know that I'm sensitive to this, avoid. Avoid contact in all forms. Direct contact, distant contacts, like it is lying in your room or lying in your office or in your way, passage, corridor, like this. So avoid taking offending drugs, maybe antibiotic, maybe NSAID. Avoid using that chemical. Don't use that sort of chemical for the painting of your house, walls and doors, windows. Many, from painting, I am reminded of dyes. Many dyes, many brands. Not to all, but maybe in 1,000%, one may be sensitive. He will get some sort of reaction. It may be allergic, maybe urticarial type of reaction, maybe severe type of reaction, anaphylactic, like that. So avoidance is the mainstay. So don'ts and do's, I have already told. Make clean, keep clean, that's all. Avoidance is the mool mantra.
The best thing, as sir has mentioned, is to be careful and be very, very specific. If you are allergic to certain things, so please avoid that. That is the best thing that
Of
sir has
course,
mentioned.
of course, of course. 100% agreed.
Okay, so sir, suppose the patient is taking the treatment of urticaria and finally he got rid from it, and he's also very, very careful. He is ignorant. He's not even taking the things that he was allergic to, but still he's getting some red spots, some hives. So
You
what
may,
could be the reason?
you may get, as I have told you, not necessarily it will come from the contact with some drug or chemical or temperature or this and that. It may come from some other things also, like solar urticaria, like aquagenic. You go take bath, you are having this. You are thinking I am not doing anything abnormal, but you are getting that urticaria. You are doing some job in your machine room, you are getting urticaria. You are sitting in your chamber, turning on the AC, you are getting urticaria. You are going to take the ice for your glass of water, it has come in contact with you have put your fingers or your hand with pressure on your friend's hand, and your friend is having urticaria, pressure urticaria. So this is like that.
So one doesn't have to be tensed about it. The best thing is take the proper treatment from the dermatologist. And
Keep your eyes open, always ready to mark. This thing is causing me that thing. So that thing is to be removed. For that, this thing is to taken out. That is
very, very important point. Yes, very important point we got to know over here, that it is your duty as well to be aware about which thing is harming you, and then you can take the treatment from the dermatologist, and based on that.
You come first. Your duty, let me elaborate, you come first. Once doctor has sensitized you, now you have to take care of yourself, that you don't get it again. So you come first. Yes, please.
Okay. So, sir, we got another question from our live viewer, and it is from Adi Singh. He's asking, what is urticaria pigmentosa? And how is it different from the common urticaria that we get?
Urticaria pigmentosa is a different congenital condition. Don't confuse it with this. Pigmentation, thickening, and this and that, everything occurs in that. That is a separate thing. This and normal urticaria is caused by, as we have discussed, so many things, and that is completely another thing, genetic thing. Don't go for that. Don't worry for that also. If you don't have got, it comes, it generally may come in families and like that, inheritance. So don't worry for that. They are two quite separate things, as I have told you.
Hmm. Okay. Uh, and sir, suppose the person who is not taking the treatment of urticaria at all, he's thinking that it will go on its own, it's just the red spot, red, like the rashes that he has got. So what can happen if one is very ignorant towards this condition?
If it is mild, if it is mild, occurring somewhere in hands, legs, extremities, or trunk, or face, or like that, he is not taking drug, keeping himself away from all those triggering factors which we have discussed, which you can go for on over Google or in any textbook. So chances are it will go away by itself in after certain limit of range of time, maybe 1 week, 15 days, 1 month, 2 months, like that. But if it is moderate or severe, intense itching is there, swelling is occurring in your eyelids, lips, tongue, how will you survive?
Hmm.
The difficulty in breathing will start. How will you survive? Then, of course, in that case, you have to go for treatment. In mild cases, only you can ignore, but he will not allow you to ignore. It is very, it may be, no, it is not, but it may be dangerous for you.
Yes, yes, definitely. So in the mild cases, it can go on its own, but in different cases, as sir has mentioned, the condition can be really severe. So you don't have to go to that condition, just take the treatment at the right time. Okay.
Mhm.
And sir, because of COVID, there are many side effects, so there are many health conditions that the people have to go through.
Mhm.
So is urticaria also caused because of one of the like COVID symptoms?
Yeah, in single word, it can. These are generally small, oval, shaped, more found on the face or trunks or like that. So, uh, not immediately, but it can occur even after months of the acute infection of COVID. So be careful and give the doctor full history. Then only he will come to the conclusion that okay. And nothing to worry, it is not a serious type of thing. It can be managed, especially post-COVID.
Okay. So yes, it can cause urticaria after COVID. And sir has mentioned that not immediately, sometimes even after a few months, you may experience some symptoms, but there is nothing to worry as it is treatable. Okay. So sir, when we take the treatment of urticaria through medication, so are there any side effects also related to the medicines that we take to get rid from urticaria?
Of course, of course. There are side effects. There may be side effects of almost everything. Even you drink 4 or 5 glasses of water, there may be side effects. So in that case also, I would tell that if you take the drugs with the advice of the doctor, no need to worry. Suppose antihistaminics, H1 group used to cause sleepiness or like that. Then we came with H2, but in many cases you have to increase the dosage to double, triple, 4 times. In that dose, it may become sedative
Mhm.
in that dose. In normal dose, it may not be. That also is a side effect. You may have to use corticosteroid. In mild doses, nothing. You give it for 1 week, 2 week, 3 week, like that. In tapering doses, of course, as the condition is brought under control. But if chronic spontaneous or chronic idiopathic, you have to use it for a prolonged period of time. Then again, there are side effects: hypertension, cataract, glaucoma, fall of hair, thinning of the hump. um, all these, there are so many side effects, not to discuss too much. There are certain cytotoxic drugs which are given in the patients insensitive to antihistamines and to prevent prolonged usage of corticosteroid, cyclosporin, methotrexate. So these are steroid sparing drugs, but their side effects also is there. So everything is to be used under guidance, under control. You have to switch over from this to that, just to minimize this its side effect. Then you go for this, minimize its side effect. After a while, then you again go for the third, go for the fourth. So I would like to emphasize that don't panic, have patience. It will be controlled. Your doctor will control it.
Definitely. Okay. And sir, there are people who apply even ice cubes to treat the redness or the swollen part. So is it really beneficial or is it harmful?
Used to which part? Swollen part.
Redness, to get
Cases
rid of
of
the
trauma.
redness.
Trauma.
Yes.
Cases of trauma. It is useful in cases of trauma, but not in cases of urticaria. It may itself cause cold urticaria. But in cases of trauma, many orthopedician friends I have seen, they advise that, okay, go and apply this and like that.
Mhm.
In those cases, it may be useful, but may not be in cases of urticaria cases.
Mhm. So here it becomes very essential to know, this is for all the live viewers. So before applying anything on your own or trying to be your own doctor, just consult a dermatologist and take the guidance and apply or take the medicines whichever has been prescribed so you can get the proper treatment at the right time. And as sir has mentioned that it is completely treatable. You can get rid of urticaria. There's nothing to worry. It's just about taking the right
It is
treatment.
almost completely treatable.
Yes, it is almost completely treatable, so there is nothing to worry about it. Okay, so sir, in the end, what is the suggestion to all our live viewers that are listening to you so patiently and trying to know about urticaria, hives, and the relevant treatment about urticaria?
I would like to tell two sentences. First will be, don't panic. Second will be, don't self-medicate. That's all. Go to a certain certified doctor and take his advice. And you will be okay. It is not going to kill you. It is not going to kill you then and there. Nothing like that. Don't panic. Go to doctor. He will take care of that. Yes.
Certainly, we got to know many, many important points about urticaria. We got a clear picture of what is it and what are the causes, types of urticaria, and the proper treatment available of urticaria. So, sir, it was indeed a very, very informative session for all our live viewers. They got to know many things about urticaria and the treatment part as well. So, once again, thank you so much for your valuable time, sir.
Welcome, welcome. So fine meeting you and all the audiences. Thank you very much. Thank to the pharma people. Thank you, everybody. Thank you. Good evening. Good night.
And thank you to all our live viewers for being so patient and asking all the questions related to urticaria and its treatment. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of All About Skin Allergy. This is your host, Varsha, signing off. Take care, everyone. And thank you so much, sir, once again.
Bye till then. Bye.